not quite, to do this oncology. And I know that y'all have a test coming up this week that you're more interested in studying for. However, you just gotta put it to the side for a little while, okay? Because if you don't, you're gonna miss what you need for the next one. And it'll snowball on you and you'll be worse off, okay? So try to pay attention. I'll try to make it as concise as I can because, like I say, we've got a lot to cover in a short period of time. And there are some resources that I want you to pay attention to, and especially on this oncology content. In Evolve, you have different chapters that speaks to you about the content, right? Y'all realize that on your student resources? Okay. This course, or this topic on oncology, does an exceptional job on key points. All of you need to go and copy those key points, and that will help you with this topic. It'll help you with the information that you need to know. All right? Chapter 22 is what I'm thinking is the care of the patients with cancer. And y'all can validate that because I know that on some of these e-books, when y'all move from one edition to the next, I kind of get lost in the back somewhere. Keep using the older one, you know. But it's care of the patients with cancer. The key points on that chapter kind of follows your PowerPoint. You know what I'm saying? And it does an excellent job. It's like this. It does an excellent job of explaining it to you. And I'm going to be going over a lot of this with you, so it's just going to be helpful to you to have it. Okay? The other, I think might be on your modules already. The other chapter that we went ahead and, I think last time, put it on the module, and that's the one on chapter 7. And like I say, I'm not positive about your chapters in edition. Y'all in 9, 8, what? 9, okay. Anyway, it's the chapter on end-of-life care. So you've got 2 sets of key points that you all need to print and study. All right? Just to have a good overview of this 2 hours of oncology. Okay? There are some key terms and things like that, but like I say, this does a real good job of summing everything up for you. Okay. As far as the objectives are concerned, I think it only says chapter 22 on your syllabus. It says 21, 22? Well, I've got a whole bunch of objectives, man. Sorry. Okay, so hopefully I don't mess up anything. Y'all tell me if I do. All right, y'all know how I am. As far as concepts are concerned, you all need to think at this point in your school, you need to start thinking conceptually anyway. You need to start thinking about the big picture. You need to think about, like on our priority concepts here, you all have a concept voiceover that's listed on your canvas that you can listen to that'll help you understand what we're dealing with in the oncology content for level 3. The concepts that we talk about is cellular regulation, immunity, infection, nutrition, pain, fatigue, coping, and safety. Those are your big concepts that relates to the content. All right, the objectives. Y'all know I talk about the objectives. The first objective is to analyze the care options and resources for clients with a terminal prognosis. All right? Now, there are a lot of options, a lot of care options. And when you go into looking at your key points, those care options are there for you. Okay? Now, I'm going to mention them, but I'm not going to mention every little detail about them as it relates to what's on these key points. You can look at that later. We don't have time for that. All right, but think about this for just a minute. Some of the care options that you may have for a person who has cancer would be surgery, right? Now, y'all realize that surgery was the very first treatment for cancer. That's the first thing that they did for a person who had cancer was to take it out. All right? And that's still something that's used today. However, sometimes taking the tumor out might be more of a palliative type care. Do y'all know what that means? Mm-hmm. If it's a palliation type care, what does that mean to you?
Just to make them more comfortable.
That's right. That's to keep these folks comfortable. It's not a cure, right?
Right.
Now, the surgery could be a cure, but it's not necessarily a cure. All right? So anyway, that's one of the care options that we look at as far as taking care of folks with, it says a terminal prognosis, but there again, it's not always terminal, right? Okay, but it could be. And the next one that I put on my list, they've got surgery here, and the next one I had was chemotherapy, and it's listed on here as well. And you all are familiar with chemotherapy and what it does. You know, that it kills all those bad cells, but it also can kill good cells, right? And y'all know some of the things that goes along with that, and we'll talk about that a little more detail in a few minutes. I'm just kind of running through the objectives with you right now, okay? And then the next one I have on my list is radiation therapy. Now, you all know that radiation therapy can be internal or external, okay? And we'll talk a little more detailed about that, and that's on your key points as well. Y'all gonna love these, I'm telling you. I did. Okay, and then targeted therapy. That is a type of therapy that targets certain cells. And with research and all, they have done a really good job of trying to target gene therapies and things that may contribute to a person getting cancer. And they're developing drugs and things that will target those specific types of cancer. And so that's what we're talking about there. And then we have immunotherapy. That's becoming really popular with patients who have cancer. You know, we can boost that immune system, okay, to help folks to fight off this cancer. Then stem cell transplant. And I'm going to ask Jonathan, you know, in just a little while to speak to us about the stem cell, okay? Because he has personal information about that he can share with us. And that comes better than me standing up here talking to you about it. And then we're going to talk about things like hyperthermia. Y'all kind of know what that is, right?
Increase body temperature.
That's right, increase that body temperature. And then phototherapy. That's a new one now that they're using, like a photo type dynamic. They call it photodynamic therapy. I'm just looking on here for just a second. I don't know if it's on here or not as far as that. They've got the immunotherapy, they've got the targeted therapy. Yeah, they got a little bit about photodynamic therapy on here. It doesn't say much, it just says it's selective destruction of cancer cells through a chemical reaction triggered by a laser light. Laser light. So anyway, it's on your key points. That's a way to take care of it. And so then, I just put on here things like they can do blood transfusions. They can do, like I say, that use of lasers as far as cancer therapy as well. So I tried to cover all of them that I could think of. And like I say, the majority of these are explained on your key points. and they do a really good job, okay? The next objective is to ascertain the role of the nurse when providing and coordinating the care of clients with oncologic conditions. And this is where we're going to talk about what you as a nurse will do when you're caring for someone who has cancer. Now, on that end of life key points that you all have, that speaks to you about taking care of these folks when they're dying. All right? And as nurses, you are going to be facing that somewhere, somehow. Whether or not they're dying of cancer or they're dying of something else, you're still going to be facing taking care of someone at the end of life. And I've had some situations, I've been in nursing going on 45 years, and I've had a lot of situations where I was in a position where a lot of people were dying, and I was there. Well, I'm going to tell y'all that's a privilege and an honor to be there when somebody takes their last breath. Okay? Not that they're going to remember you, of course, but you will remember. And you will feel good about why you're a nurse. Okay? Because not only do we help people to live, we also help people when they're dying, to be there for them. Okay? And be respectful of that. And even in postmortem care, that's one of the things y'all need to remember always. Is, you know, we don't know. People don't come back from the dead and tell us what they hear last or what they think last or whatever. But always remember to be respectful. Okay? Even though that person may have taken their last breath and they are not, you know, physically or maybe mentally there with you either. Okay? You just got to keep that in mind that you've got to be respectful. All right? Always remember that. Because that's just the last thing you can do for them. Okay? Just be respectful. I've been in a situation several times during this time I've been teaching here, not only in my nursing career, but here, and had students in clinical that we did postmortem care. Have y'all had an opportunity to do that? You have. And see, that's a privilege to be able to do that. But I had a situation one time where I had like 3 or 4 of the students that went in to take care of this person who had died. And I'm just telling you, I was very appreciative of the fact of how respectful they were, and how when that family came back in to see that person, they had them just perfectly laid up there like they were sleeping. And they were clean, all the linens were clean, everything looked good. So that was what that family remembered about that patient being in the hospital and not laying up there with all those tubes out of every orifice, you know, and stuff. They remembered how those students left that patient so nice and calm and looked like they were sleeping. Okay? So y'all just keep that in mind. That's real important as a nurse. You know, y'all can take a test whenever you take a test, and you can answer all these kinds of questions and all that kind of stuff. But you gotta know that all this means something to people. You know? So just keep that in mind. All right, I could go on and on about that, but this speaks to you about professionalism, this objective, and how you treat people who have cancer and who die. It speaks to you about communicating with them and their families. Speaks to you about taking care of these folks involved in different disciplines, because there's a lot of different disciplines that are involved in taking care of a patient. What other kind of disciplines do you think might be involved in a person who has cancer? Living or not living? What do you think? A different discipline, different professionals that take care of these folks. Yeah, you can have a specific oncology doctor, dietitians for nutrition,
Respiratory.
respiratory therapy,
Social work.
physical therapy, occupational therapy,
Social work.
social workers,
Also financial services.
financial services,
Hospice.
hospice. You see what I'm talking about? Y'all, it covers everybody. You know, it can cover a surgeon, right? It can cover any of these disciplines. So this is one of the areas where you've got collaboration going on amongst a whole lot of people to take care of this person's condition. And then, of course, it talks about evidence-based research. And a lot of these drugs that we use now, you know, we're looking at like the immunotherapy and the gene therapy and all those new things they're investigating now they come to find out how it's starting to work for people. But that's because of so much research that's been put into it, and they're using it now, and it's saving people's lives. So anyway, we'll talk a little bit more about this in a minute, but that was just kind of where we were going with that objective. But y'all mentioned a lot of it. And then there's one thing that's going to fall under this objective that is not here, and it's not spelled out very well, but it's the oncological emergencies. And this used to be in level 4 content, the oncological emergencies. However, we moved that to the oncology because it was in the immunity section for level 4 and it just didn't work, okay? So we've moved it into level 3. And so we're going to go over the different oncological emergencies. And if I'm not mistaken, yes, it's on your little key points, okay? But it's not to the point of a whole lot of explanation, so you'll need to go to your book and look up those oncological emergencies and learn about those a little bit more in detail than what's on your key points. But we'll touch on them today as well. And there's about 6 or so of those. All right, the third objective says compare and contrast the various types of radiation therapies, related side effects, and nursing interventions. This has to do with external radiation. All right, what's that called? Do y'all know? What's the word they use for that? Y'all know
External
yet?
radiation.
Radiation therapy.
Yeah, it's called radiation therapy.
Is it
That's right.
relative?
But this is the one that's external. I'm just looking on your paper to see if it's on there. Teletherapy. There you go. It's on here. Teletherapy's on here. I'm telling y'all. That's why I'm telling you. All right? This is a hefty. It's a way of an outline for you. Okay? So when we're talking about a beam that's coming from the outside, that's what we call external, right?
Mm-hmm.
And that's what we call teletherapy. All right? It's coming from the outside. Now, the next one is the internal. What do we call that?
Brachytherapy.
There you go, y'all got it. Brachytherapy. Okay. And so, what do y'all think of as an internal example?
Like the pills they swallow?
Okay.
The radiation pills?
Okay.
What about the little pellets they put in?
Yeah, the radioactive beads.
Radioactive beads or whatever.
Well,
Is that
that
the
could
same
be,
thing?
and it could be the intracavity depending on where it is.
Okay.
Okay, but nonetheless, it's inside, right? All right, but I also, like you were talking about, I think about like the I-131, the iodine one, you know, that they give to target the thyroid. Okay, the I-131. Okay, and then we think about those ones that they put into the cavities, like this is like the intracavity is the next one. And you think about one that maybe they're going to put next to, like if they did something for, say, uterine cancer or cervix cancer, or, you know, like if they put that into the vaginal cavity there and left it there, you know, that's giving off that radiation. That's called an implant there. However, what they'll do is they'll take that out. You know what I'm saying? It's something that's not going to stay implanted. Okay, like the little seeds for the prostate that they put in, that'll just stay there. Okay, they won't take those out. But if you have something like a sealed isotope or something that they put into a cavity, then that'll stay there for a period of time, and then that's removed. Let's see what else. The next thing on here just talks about safety principles as it relates to all these types of radiation. And what y'all need to just think about there's a whole bunch of little safety things. And we'll talk about some of those as we go through, okay? All right, so basically that objective just has to do with the different types of radiation therapy, side effects that can come from the radiation, and as nurses, how we're going to take care of these people. All right, the fourth one talks about compare and contrast surgical treatment goals related to cure and palliation. Well, we mentioned that already. You know, when people have surgery, sometimes it's to cure it, sometimes it's to promote comfort, right? And I think you just need to, like I say, you can look on your key points and it'll speak to you about the surgery, you know. And then we'll look on the palliation type care on the end of life care, and that'll help you understand more about how we take care of people just to promote comfort. See, this is not a difficult topic, guys, right? It makes sense, right? So, I mean, you know, if you just think about it, then, you know, you're going to be okay with it. All right, now number 5 says integrate knowledge of classification, actions, contraindications, potential side effects, and nursing implications of medications used in the treatment of cancer. All right, so when we're looking at medications, there's some lists of the different classifications of drugs on your content topics. All right, let me just throw out a few things at you right now as it relates to medications. All right, think about if you're giving somebody chemotherapy, all right? What is something as a nurse, chemo's a drug, right? How do we give the chemo?
Oral, IV, there's multiple different methods.
Okay, so you could give it IV, of course, or you could give it by mouth, right? You could give a PO form of chemotherapy.
TKI, Lindax, December.
Pardon me?
Most of your TKIs are oral.
Okay. And they could do the, what do they call that? The, goes into the cavity, into a cavity. You know,
Like the interventional?
no, I'll think of it in a minute. It's a word that they use. I'll have to stop, intrathecal or something like that. I'm trying to remember. All right, but my point here is it doesn't matter whether you're doing, however you're giving that chemotherapy, there are precautions that you as a nurse would have to take in giving chemotherapy, whether it's PO, IV, through an intrathecal type catheter or whatever the case may be, into a cavity. Okay, what do you need to do? How do you protect yourself?
Wear gloves, mask,
Mhm.
gown,
Okay,
double gloves sometimes.
all right, you got to have proper PPE. Okay, now, most of the time when you're doing PPE for chemotherapy, you're going to have to double glove, okay? And not only do you do that for IV chemo, you also do it for PO, okay? Because those drugs could absorb through your skin regardless of how you give it, all right? So just always remember that. PO, IV, whatever, you've got to wear the proper PPE. Now, most nurses wear gloves. They wear gowns, right? They might even need a mask or goggles, depending on the situation. So the appropriate PPE is really important, regardless of how you give it. What else is important whenever you're giving chemotherapy?
Make sure you check, like if it's IV, you make sure you check that the IV is properly placed so it doesn't
Risk
infiltrate
for
into the skin.
extravasation.
That is correct. Y'all got it. Okay. You got to make sure that that drug is going into a vein and not outside a vein, right? Because if it happens to infiltrate, then what does that lead to, would you say, John?
Extravasation.
That's right. It gets outside into the skin and it eats up that skin, right? And then people end up having to have a surgery to remove all of that skin that's been damaged from that chemo drug. And how are we as nurses going to prevent that from happening other than just checking. How often are we gonna check?
Check for blood return.
All right, we're gonna check the blood return. We're gonna constantly being observing, but how often should we observe that site?
At beginning of therapy, and isn't it every 5 minutes?
To begin with, you'll want to check it pretty frequently, but as a general rule, at least every hour.
Hour?
At least every hour you should check that site. Okay? That's important. All right, and we can take this chemo a little further, and I guess I'm talking more about chemo right now, just simply because of side effects of drugs. Okay? This makes more sense to me. Talk about it now. If you've got a person who is getting a chemo drug, what kind of side effects do they get from the chemo drug?
Nausea, vomiting.
Nausea, vomiting. Y'all know that's a typical thing, right? Okay. So if you're assessing a patient, then would that be a priority to assess for nausea and vomiting?
Yes.
Yes, it would. And why is that a priority? Why is it important?
Dehydrated.
Because they might not be able to keep it down, and you may want to suggest adjutant therapy of Reclin.
Okay. All right.
It's the most common one to get a low down.
Okay. What y'all need to think about with that, and everybody's correct. I mean, this is not rocket science. Y'all know this. Y'all understand nausea and vomiting is a priority. Y'all understand why? Because this person could throw up so much that they would dehydrate, right? And then that would cause electrolyte imbalances, and that would be a bigger problem for them. So y'all know that. It's one thing leads to another. Okay. So that's what we as nurses have to do, is to assess, and reassess. Okay? And so we have to report things that they, like if they're having that nausea and vomiting, like you pointed out, you know, they may need to get some medication for that nausea and vomiting, because that's something that has to be taken care of to prevent an electrolyte imbalance. So let me look on here for just a second. On the chemotherapy, on your little key points on the chemotherapy, just talks about how that it, you know, it's going to kill the bad cells, but also going to kill the good cells. So it talks about these drugs specifically are designed to treat certain types of cancer. And it may be more than one drug that a person has to have. And what do we think about with chemo drugs? What do they do whenever, not only can they cause the nausea and the vomiting and the electrolyte imbalances, but what else do they do?
And alopecia.
They lower the immune system,
Nadir.
right? Nadirs. N-A-D-I-R. Nadirs. Okay, what does that mean? The nadirs.
It's the
It's like
lowest level
point
of
your
white blood
immune
cells.
system.
That's correct. That's like when a person gets a chemo drug, then not only is it going to destroy the good cells, but the bad cells as well, and it's going to cause a person to have a decrease in their white blood cells, right? Which fights infection. And after that chemo is administered, there's a period of time where those drugs have knocked that white count down to its lowest point. And that makes them real susceptible to infections. Now, my son had chemo, and he went outside for something and got a bug bite, put him in the hospital, just from a mosquito bite or something. Huge red area, swollen up, and had to have antibiotics for days because he was at that low point, that nadir's point, okay? So I've seen that firsthand, and I'm sure some of you have as well. But they kind of know that going in when they give these drugs. They kind of know when that's supposed to happen, you know. But that's where good patient education comes in, telling people something simple like that can cause a big problem. All right? I'm trying to look on here to see if there's anything else we want to talk about with that. All right, another thing. that is on here, that I want to make mention to you too, it talks about other type side effects, because when they, and it talks here about the bone marrow suppression, which means, you know, we may not have all those white blood cells, and induced nausea, vomiting. It also speaks to mucositis. What does that mean, y'all?
Your mucus membranes are inflamed.
That's right. And a thing that kind of goes along with that is what they call xerostomia. It's with an X, but it says xerostomia. I think it's more like a Z instead of an X. All right, what does that mean? Xerostomia.
Yeah,
Dry mouth.
Drama.
Dry mouth. Okay? They have dry mouth. Okay? So that's a common thing, you know, that we will see. But then y'all remember seeing the thrush and all that kind of stuff that can go along with it as well. But dry mouth is that xerostomia. I just want y'all to make you aware of that word. And what's alopecia?
loss of
Loss
hair.
of hair.
That's right. That's loss of hair. So, like I said, y'all know this kind of thing, but you do need to review it, and it is on this handout for you, okay? And it talks here too about, it says here, assess the venous access device at least every 30 to 60 minutes is what this says. So at least every hour, but it says 30 to 60 minutes. And that's on your little handout. It says assess the patient for an infection every 8 hours. And it says inspect the oral mucosa of a patient that has neutropenia, which means what? What's neutropenia?
Decrease white blood cells.
That's right, that's low point. You know, nothing to deers as such, but they still are neutropenic when they don't have as many white blood cells. And they say check that every 8 hours for their mucous membranes. And here's another important point. Anytime a patient who is immunocompromised has any fever, that's a priority. Any fever. Y'all hear me? Okay. It says here report any temperature over 100 in a patient with neutropenia. It says 100 on here, but I'm thinking anytime they got a fever, that's a signal, that's a red flag. Okay? Intrathecal, that's what I was trying to remember, and that's where they deliver the drugs into the spinal column. That's what I was trying to remember. And it mentions that on here. Then it talks about intraventricular routes, like into the
Brain.
ventricles of the brain. Yeah. So there's different ways, is what I'm saying, that they can give chemo drugs and stuff. Talk about the bladder, vesicular route. So there's different ones. But this goes on about that, guys. This is an excellent handout for you. So that's all I'm going to do about that right now. Okay. The next one has to do with the sixth objective says evaluate client response to med-surg interventions for malignant conditions. And this is where they talk about the bone marrow and the stem cell transplant. And they just got one here as an example of the radical neck resection. Do y'all know what I'm talking about? Where they do take all those lymph nodes out in the neck. You know what I'm saying? Okay. And with that, this is what I'll say to that. Is that when, and my daddy had a radical neck, so I'm very familiar with all that. And, you know, when they go in and they take all these lymph nodes out, they take them out to biopsy them for one thing, but they also take them out because they have cancer in them. And one of the things that you remember and think about, and we mentioned it with radiation and even with chemotherapy, if you've got a person who maybe has radiation to their neck, then what is that going to affect?
Everything over there. Airway.
It can affect anything in this area, right?
Yeah,
And when
hearing.
we just talked about that xerostomia, you know, that's that dry mouth, because it messes with those salivary glands in that area. So they get a drier mouth, okay, as a result of either radiation, surgery, chemotherapy, whatever. So what would be important for us to remember as nurses if we're caring for someone who has have a radical neck that maybe had some radiation, maybe is bothered with this xerostomia, what would be something as nurses that we would think about?
Their gag reflex.
Maintenance of airway, the risk for dental disease, which could cause infection, the dry mouth issue.
Okay, very good. What else y'all say?
I said push fluids, like encourage them to drink.
Okay,
Mhm.
all right, so you're gonna be watching for that dehydration and hydration, because they do have that dryness in their mouth. All right, one other thing y'all didn't say that I wanted you to say. Make sure you think about mouth care. Did y'all say that?
I said it.
Yeah.
I'm so
Dental-
sorry.
Dental
I
hygiene.
can't hear everything,
It's okay.
but that's good. Yeah, and like you said, you know, check gag reflexes, check for tooth decay. A lot of these people, that's an issue, and it's mentioned in here somewhere about tooth decay, because that can be an issue with people having radiation and having things done around these areas, okay? And you have to look at that. You have to think about all these things that can happen. All right, so that's the objectives. The what's left here on your objectives, and I'm gonna, like I say, we're gonna go for a few more minutes, and then we'll take a short break and we'll come back, because I still got a lot to tell you. All right, I just want to get through these objectives. All right, but as far as your content is concerned, you've got the pharmacology talks about cytotoxic agents. What do y'all think that means? Cytotoxic.
Cellular toxic,
Uh-huh. What do you think?
something that's toxic to the cells.
That's right. So it's gonna kill the bad ones and the good ones, right? Do y'all know an example of chemotherapy?
An example,
Give me a name.
Gleevec,
Okay, adriamycin. Okay, there's so many. This Christine. 5FU. Okay, do y'all remember? Didn't we just talk about 5FU?
That's
Yep.
what I was trying to remember. I was like, what is it, five
Yeah,
FU, five
fluoracil or something like that. The 5FU. Y'all gotta know that on your integument test about the eroding and all. Y'all gotta know that.
Gleevec, Fasinga, all the TSIs, TKIs.
Okay?
Those are all oral therapy.
Right, right. All right, but let me tell you, adriamycin, somebody mentioned adriamycin. Y'all, when I was young, in the 70s, and I was on IV team for about a year and a half, we gave all of the IV meds across hospital, all of them. All right, even chemotherapy. We would give some chemotherapy. I gave a lot of 5FU back in those days. And that was in the vein, not necessarily on the skin cancer, but it was in the vein for cancers. And I remember adriamycin. I went in one evening, relieving one of the nurses, and I went in to hang a med on a patient, and I looked up, and it was red. Yes, it was red. And I thought, oh, never seen that before. And so I go to looking, and y'all, this was a lesson learned, is that the doctor had ordered amikacin, which is an antibiotic. And the pharmacy field, they are the ones that prepared this, and they read it as adriamycin. Guess what?
That patient got a dose of chemo.
That patient got a dose of chemo, and I was in there when the doctor had to tell them they got a dose of chemo and they're gonna lose some of their hair. And they did. But the hospital didn't get sued, just simply because the doctor was very upfront about it and told them it was an error. And that they would probably take care of their hospital bill. I don't know. But nonetheless, that happened. So that's why I'm telling y'all, even with these kinds of drugs, y'all gotta be careful. You know what you give. Pay attention. All right, then we got hormonal agents. What does that mean to us when we treat with hormones? What kind of things? What y'all think?
Estrogen.
Yeah.
Estrogen.
That's right. Things like estrogen, progesterone, okay?
Testosterone.
And what do y'all know about if you're given these kind of hormones? What do y'all think is one of the complications that you might get from taking some progestin or estrogen?
Well, if it's in men, you'll have gynecomastia.
That's right.
You might have hirsutism in women. with
That's right.
Testosterone.
That's right. So getting
The-
more hair.
adoption of alternate sex characteristics based on which it is.
That's right, whether you get the estrogen or the progestin, you may look like more
More
female
feminism.
type things with, the estrogen versus the progestin with the male look. Y'all kinda got that, right?
Yeah.
Okay, good. All right, what else is a side effect that, what else could happen do we watch for as nurses if they're getting a lot of estrogen or progestin? What do you think? Huh? That's right, thromboembolism, DVTs. Y'all know that, right? Women that take birth control and all, don't they tell them watch for blood clots? Right? Y'all think like that, okay? You might have a DVT. You gotta watch these folks with DVTs. All right, how you gonna know if they got a DVT?
Redness, tenderness, you gotta look.
Well, that's right, you gotta look.
You guys, you can do the venal studies, fluoroscopies and stuff.
Okay. What else as nurses, though, might we do to
Put
know
the-
that somebody might be getting a clot in the leg? Check pulses. What else?
Monitor their lab.
What's that called?
Fever, home in their cabinet.
The home.
Home
Is that what you're
inside.
talking about? Positive home inside. All right. What I'm looking for here, people, is to measure them calves.
Oh, the,
Measure the calves. If you see it's getting red and swollen, you need a baseline. You know what I'm saying? You need to know what the size of these calves are so that you can, determine whether it's getting worse. Right? Y'all do that with stuff, right? You measure, get baselines. Okay, the next group on here is the biologic response modifiers. And these are like interleukins, interferons, those kinds of things. What they do is what? They stimulate the immune system, right? And what they do is to destroy bad cells, basically is what it is. It'll stimulate the immune system to destroy the cancer cells. And I think what happens, some of them block the nutritional status for these cells, is the way I understand it. It doesn't allow them to get some of those nutrients that they need to survive. Isn't that interesting? Yeah. All right, then targeted drugs, like we talked about earlier a little bit, that's targeting certain cancers, certain cells. And they are using, like I say, a lot more immune therapy, a lot more gene therapy, monoclonal antibodies, right, to be able to target these specific cells. And they're getting good results from it. And this is where I interjected that photodynamic type, where they use the laser light, to target cells as well. All right, y'all want to take a 10-minute break?
Please.
All right, come back at